Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gollin.
Hello, everyone. First of all, I want to let everyone know that I'm doing this live from Naples, Florida, in a hotel room. I'm at the ACG Florida Gastro Society Symposium in Naples, Florida. So I apologize. We have some guests. I have my dogs with me, Charlie and Oliver. So if you see them popping around the screen, don't be alarmed. This is the best I could do for a quiet spot, but it's not going to make the content any less important or engaging, I hope. Anyway, we're still honoring March Colorectal Cancer Awareness Month, and this episode continues to shine a vital spotlight on a potentially deadly yet preventable cancer, colorectal cancer. Now, in the United States, colorectal cancer is the third leading cause of cancer-related deaths in both men and women, and it's the second most common cause of cancer death when the numbers for men and women are combined. Now, it's expected to cause about 53,000 deaths during 2023. Now, CRC, or colorectal cancer, affects men and women equally, yet few Americans know that colorectal cancer can be prevented, not just detected, through colonoscopy. Now, the key to a successful colonoscopy is a proper bowel prep, so the colon is completely clean. Now, this makes it optimal for gastroenterologists or an endoscopist to see your colon clearly, and most importantly, to be able to find and remove any of those polyps. Now, the removal of these precancerous polyps is vital to the prevention of colorectal cancer. Now, here to drill that point home is the renowned Carol Burke of the Cleveland Clinic. She is a staff gastroenterologist and director of the Center for Hereditary Polyposis at the Cleveland Clinic in Ohio. And she's also the author of Colonoscopy for Dummies, which has a great section on the colonoscopy bowel prep. Welcome, Dr. Burke. It's so great to see you today. Thank you for joining us.
Oh, it's a real pleasure. March is Colon Cancer Awareness Month, so this is really important and timely.
Yeah, and we couldn't think of a better person to talk about the bowel prep than Dr. Carol Burke. So we're going to jump right into it. And one of the first questions I'm sure is on everyone's mind is, why are so many people afraid or fearful of the bowel prep?
I have to negate that old wives' tale, Jackie. So it used to be that the only availability for bowel cleansing was a gallon of solution that didn't really taste great. But over the last decade or two, there's a whole variety of bowel preparations that are much more palatable. They're much smaller volume. So I think that being afraid of the bowel preparation should really be something in the past. There's nothing to be afraid of in terms of colonoscopy, and either the pain, the prep, the outcome. I think that people just need to get over it and say, let's explore the options available for me.
Yes, and that's why we have you on. I agree. As soon as people hear colonoscopy, it's like, oh, the prep. But they're not in the know. They don't know all the great things that have advanced since their grandmother had a colonoscopy. So we're going to talk about all these wonderful new options for patients and really help get more people screened. So my next question is, and it's an important question, why is the bowel prep so important before a colonoscopy?
That's a great question. And people try to trick their gastroenterologist when physicians provide their patients instructions on how to clean the colon. They think that eating a full dinner the night before, no one will find out. But I have to let you guys know that it takes about 72 hours to clean your colon of bowel movement, right? So, what you eat the night before will still be in part of your colon. And you can imagine, as important as choosing the physician that's going to be trying to find polyps or, disease state in your colon, it's equally important to clean out your colon, because if your colon is full of bowel movement, we're not going to be able to see anything. So, you drank a bowel prep, or maybe not enough of it. You didn't follow the instructions and eat. You brought, you left work. Maybe you brought a friend in who left work. So, there's a lot of time and energy spent to get you ready to have the colonoscopy. And what you don't want is an exam where someone says, you know what, I couldn't see anything. So, we're going to have to reschedule tomorrow or, soon. So it's really important to clean all of that stool out, because some polyps, and 30 to 60% of people will have a precancerous polyp in their colon. They're not always very large. They can be subtle and small and numerous. So if you don't have a completely clear colon, like the inside of your mouth, that's how it should look when you're done with your bowel prep, nice and clear, then it's going to make the physician's job more difficult. The procedure could be prolonged. The procedure could be even canceled. So it's really important to follow the instructions that your physician provides so you can get your body ready for the colonoscopy in terms of bowel prep. One other thing that I want to say is people think, oh, you know what? Avoidance of, I eat a high fiber diet and I can't avoid my fiber, but the scope has channels in it where we can put water in to try to wash things off, and we can put air in, suction air out, and suction liquid out. But when it comes to fiber, even a small fragment of, a cucumber seed or a lettuce skin, we can't suck that stuff out and it can clog the scope. So it's really important not only to drink the bowel cleansing agent, but also to avoid the fiber a few days before the examination. So those things don't clog the scope and cause problems either.
So that's why it's so important, right, Dr. Burke, to read the directions and listen to your doctor or nurse practitioner, because you kind of wind down your diet over the 3 days. I remember I've done a couple of these, and, you're aiming for for lack of a better description, pretty in pink colon. You want it to look really pretty in pink. And we have some great videos with Dr. Mark Pachapin that show what a perfectly cleaned colon looks like during colonoscopy. And that's what you're aiming for, right, Dr. Burke, as you're ready to scope the person.
Absolutely. So open your mouth, take a look at that glistening surface, and that's how we want the colon to look, because it is just an extension of that. It's all a single tube. And you bring up a really important point, because, I've been in practice for 32 years, and I've seen patients for their second, third, fourth, fifth colonoscopy, and I take care of patients with a hereditary predisposition to cancer. They're coming back every year. Whoa. So they kind of know the evolution of the bowel prep and what to do. But I have some patients that are newbies that just think, oh my gosh, my colonoscopy's tomorrow. Let me go to the pharmacy the day before and get my prep and look at those instructions. As you said, Jackie, the horse is out of the barn by that point. You really need to start preparing your body 3 to 5 days before. And every physician's practice has a slightly different approach, but read the instructions well ahead of your colonoscopy.
Yeah. And I've had a couple, and I know from my first and my second one, it definitely makes a difference when you wind down your diet and what you're eating in the days leading up to your colonoscopy. And I can attest personally that it does make the colonoscopy prep easier, because you don't have so much stuff in your system. So it is a little more tolerable, I think. That's my opinion.
No, you're right. And as you said, preparing ahead of time. So, getting the baby wipes that you might want to have to dab your bottom, getting all the fluids that you want to drink, the popsicles, the Gatorade, maybe electrolyte drinks, lemon ice, broth, the things that are going to be okay on the diet. And in terms of diet and clear liquids, we should get to that at some point in this. Yeah. But right. So be well prepared, because once your prep starts working, you're not going to be able to run out to your local drugstore to get whatever you need, or the grocery store.
Sorry. We have a visitor.
I know. Even dogs need bowel preps for their colonoscopies.
That's Charlie. We're at the ACG Florida GI Society meeting, and so we didn't want to miss out this opportunity to speak with you. So we made this happen. We have some guests in there, an audience.
It's a pleasure.
So I want to ask you this before we get into the types of bowel preps that are out there for patients to know about, and also some of the tips. The clear broth was wonderful for me, but we'll get into that a little later. What can a patient expect? Like, what is the bowel prep process like? And I know it may vary depending on which prep you choose, but what generally is the bowel prep process like?
So as we talked a little bit about, it's getting your body ready. So avoidance of, a high fiber diet 3 to 5 days before the exam, medications, that may need to be altered. If you're a diabetic or you're on blood thinners, may need to be altered by the physician that prescribes those medications. And then having your prep at home. And I think the important points about the bowel cleansing agent is the international standard that provides the best quality bowel preparation is drinking or beginning part of your prep the day before the exam. And most preparations are liquids of different volumes. There are tableted bowel preparations. So, there are some preparations for people that just can't drink fluid. Maybe someone's had an altered, anatomy from a Roux-en-Y gastric bypass, but mostly it's fluid, but there are some tableted preps. But basically, it's the day before when you start the cleansing agent, and you do need to alter your diet the day before. Traditionally, it had been only clear liquids the day before the exam, and then in the evening, you begin drinking half of your liquid bowel preparation or even the tableted bowel preparation. And then the most important thing is the second half of the bowel preparation needs to be taken no earlier than 3 to 5 hours before your colonoscopy. And people think, oh my gosh, my colonoscopy is at 7:30 in the morning. So if I need to, finish the last dose of my bowel preparation 3 to 5 hours before. So, I'm not sleeping, or I have to wake up at 3 or 4 o'clock in the morning. But listen, guys, if you need a colonoscopy and your prep is excellent and normal, you don't need another colonoscopy for colorectal cancer screening for 10 years. So, what's the issue of getting up if you're the first case of the day that early? Because you really want a great bowel preparation. So people try to trick their doctors like, I'm just going to drink it all the night before. But you know what? When you are sleeping all night long, your liver is producing a yellow substance called bile. And the first dose of preparation kind of gets you moving. The second dose that you take 3 to 5 hours before the preparation usually is the dose that moves all of that yellow bile that has trickled in the colon over 8 to 12 hours, that coats especially the right side of the colon, where some pretty sneaky polyps can live, like the flat polyps, the sessile serrated polyps. So you're not tricking anybody, not your doctor, not the polyp, not the bile, by taking the prep a different way. And then the other thing is, patients come, they're like, oh, I'm not sure if the bowel prep worked because I didn't start going, for 6 hours, or when I took the second dose, I didn't have anything more out. But the point is that, hundreds of thousands and millions of patients throughout the world have taken preps. There's been lots of studies done. Yeah. And the bottom line is, if what you pass out looks like urine and it's clear and liquid and not like pea soup, then you are good. Your prep worked. Caveats. There is always someone at a practice that's available for you. So if you drank your prep and you feel like nothing worked, or you started vomiting, nausea is not so uncommon. Vomiting is pretty uncommon, but if it's not working for you and you have concerns, you be sure you get on your doctor's office in the evening before the exam to say, what do I do? A lot of this is listed in the instructions, but if you need help, make sure you call the office, because they should have someone on call that can help you through it.
Yes, absolutely. That's such a great point. And I'm going to break and ask about this, because you talked about the polyps and seeing the polyps. I'm going to take advantage of having your brilliant mind as a gastroenterologist and a leading gastroenterologist in this area. Can you just briefly explain, because this is so important, why colonoscopy is one of the only things that can really prevent colorectal cancer, and why? Because of finding the polyps and snipping them out. And this goes back to the importance of a good bowel prep. And I want to just hammer this home for our listeners.
Yeah, that's so important, Jackie. So you heard the word prevent colorectal cancer. So prevention and early detection, right? So even if people have a cancer that's detected early and removed, it's cured. People don't have to die from colorectal cancer. So in terms of the prevention piece, the way that colon cancer develops is by polyps. They're like little bumps or moles on your skin that are on the inside lining of your digestive tract. And there's two types. I mentioned that sneaky sessile serrated polyp that's flat and a little bit more difficult to find. And it's usually on the right side of the colon where bile trickles in overnight. And that type of polyp can lead to about 25% of colon cancers. And then the other one is the adenoma that we've known forever. And so colonoscopy is the only tool really that can see the polyp and at the same time remove it to prevent those polyps from turning into cancer. Now, that's not to say that there are not other really good colon cancer screening methods. They're not very good at detecting polyps, maybe 50%, if that, in the best case scenario. They're pretty good at detecting cancer, and some actually rival the detection of cancer rate that you find with colonoscopy. But it's a 2-tier test where, if you have something that's like a stool test for blood or for genetic changes in the stool, you still need to go on for colonoscopy.
Yeah.
So those tests can detect cancer at high rates. They don't really detect polyps, and so they don't prevent cancer. Colonoscopy is the only prevention because it is able to detect, and your doctors can remove before cancer develops.
So important. And this so relates to the bowel prep because, like you said earlier, you have to be able to see the polyps, especially those little sneaky ones that you can't see if it's covered by some stool or some stuff in your colon.
Yeah, mucus or bile.
Mucus,
absolutely.
bile. Yeah. So you definitely want to have that clean, pretty and pink colon before you see someone like Dr. Burke. Now we're going to get into the bowel preps because this is, we really want to understand our options as patients and have some knowledge. And we know there's tons of things out there, but generally speaking, what are the most common options for bowel preps? And if they work a little differently, what do patients need to know about these options?
That's really important. And I'd like to tee it up in a different way to say,
Perfect.
what are the important things that a patient and a physician needs to consider? So safety is paramount. Cost is a close second. Palatability and tolerability are a third. So when you think about the landscape of bowel preparations, there's a variety, maybe even 10. And we talk that there's liquids, and we talk that there's tablets, and we talk that there's the old gallon. So why would someone choose the gallon of, it's called polyethylene glycol with balanced electrolytes? Because that was formulated decades ago, and it was done in a scientific method so that people don't have shifts in fluids and electrolytes, right? So the sodium in your bloodstream and the potassium and things stay stable while you're evacuating solid stool from your colon. So it is the cheapest thing and oftentimes free, and it is safe for everybody. And when we think about safety, who are the people at risk to have fluid and electrolyte shifts? It would be people with chronic kidney disease, people with cirrhosis of the liver, people with heart failure, people with some nutritional deficiencies. So one, big volume, taste not so great, but palatable. A lot of my patients actually say, hey, I just prefer to take that, and safe for everybody and cheap, right? And sometimes free. So Go Lightly is one of the commercial names. So that is one that a physician may use. But you need to think about other things. The person that might have surgically altered anatomy, the person that says, I cannot drink a gallon of solution, I am going to be vomiting. And so there's other lower volumes, a half a gallon. And if you can imagine you're splitting any of these in half, that it's, half a gallon the night before and half the next day. So there are options. I think the other thing that needs to be thought about in terms of, so everything's relatively safe. Cost can vary from the free gallon to things that are $130 or $160. And people are like, hey, I can't even afford, buying food for my kids for $160 this week. So, I want to be screened. I want a colonoscopy. So those are discussions that I think you should have with your physician. So, doc, I understand safety is paramount. There's a variety of things. I'm on a limited income. What may be right for me? Another trick is if your physician doesn't provide a bowel preparation from their office, if you go to the pharmacy and they say, here's the charge, you can say, what coupons do you have? Or you can go online and look up the bowel prep that was prescribed for you. And all insurance companies vary. So physicians might not know that, your insurance company will pay $30, your copay is $25 versus you have to pay $160. So check with your physician to say, do you know what the cost will be to me? And if they say, I don't really know, go online, look at the manufacturer and see if they have coupons, because oftentimes you can find coupons where it's only a $30 out-of-pocket copay, or the pharmacist has them, but they don't readily offer that. So ask those. So
all the tricks. I'd like to go shoe shopping with you. That's a great tip. That's a great tip. Must know all the deals. That's awesome.
Yeah. And at the end of the day, all the preps that are available work. So what are some of the other, and patients that are frequent flyers say, this one didn't work great for me. So with the split dose is what it's called. You get at least 50% on the day of the exam. And some people that have an afternoon exam, you don't even have to start drinking the bowel prep, which is the laxative, the night before. You can start the day of. But the laxative is just a certain volume of liquid. On top of that, many studies show that drinking another 2 liters of fluid help that prep flush things out. So don't just dehydrate yourself and have 1 little cup of broth and think that the laxative is going to do all of the work. It's a heavy mover, but drinking at least 2 liters of additional fluid has been shown to improve the bowel preparation. What else is important? If you've had an unsuccessful bowel preparation in the past, then you need to have a special visit with your provider to say, you know what? I didn't have a good clean out. I followed all of the instructions. And so I oftentimes, I can have a visit with my patient to say, okay, we're going to do a little polyethylene glycol cap 5 days before, a little over-the-counter laxative, Senna, 2 days before. I'm giving you something to prevent nausea because you vomited last time and you're going to take it. So don't hesitate if you've not had an adequate bowel preparation to have an individual discussion with your provider about how can you be successful with your bowel preparation the next time. And certainly people that have comorbidities, Parkinson's disease, bad diabetes, other things that may affect the ability of the bowel prep and drinking it, to have that discussion with your doctor.
So what we're really learning here is really that even though there may be options, it's not like you can go and pick. You really have to have a good discussion with your provider to really understand what's the best one for you is and how it's going to affect you. So
right.
It's not like we have freedom of choice. Yeah. So this is why we do these podcast interviews, because we learn something. Even I learn stuff, it's like, oh, how do you know which one? There's a lot more than just what you think is better for you or the flavor of something. There's a lot more that goes into it, which really is about your health and your safety. And I really appreciate that, as well as the cost. And this is great for patients. And I hope when you're listening out there that you really understand that it's not just about you can pick and choose like going to the drugstore. There really is a lot of thought and really understanding that goes into it before it's prescribed to you.
Yeah, absolutely.
So is there any other, types that patients should be aware of? Besides that, is there anything that they would need to know? I know we've heard about Miralax and Gatorade and all those things. Are these things that, again, your doctor will say if it's right for you? There's like the split prep one. But again, these are just some of them. But again, it's all about with your doctor. You don't really have a freedom of choice per se.
Well, yeah, but I think that, as you said, Jackie, you want to be fully informed. And as I said, doctor, is this safe for me with my medical condition? So safety is first, because at the end of the day, all bowel preparations generally, it's not exactly one size fits all, but all bowel preparations can adequately clean most patients out more than 85 to 95% of the time. So doc, is it safe for me? Doc, is there an option for something that tastes a little better, or maybe is a smaller volume than drinking a gallon, because it requires you to drink an 8 ounce, and from the gallon, 8 ounces of a liquid every 10 minutes. And doc, I'm a little bit worried, I'm a gagger, or, I easily vomit. Is there something that you can give me that might decrease, nausea and vomiting? So that would be another thing. And then, hey doc, in terms of cost, I heard that, these bowel preps can really vary. So what about cost? Do you have coupons, or where can I find coupons? And I just gave you some strategies. Look online, ask the pharmacist. So I think those are the important things. And then just as we talked about before, once you start your prep, you're not going to be able to run to the drugstore. So think about everything you might need from, having some wipes or some Tux pads in case your hemorrhoids flare, but also things for all the fluids that you want to drink. One caveat I wanted to mention is a lot of people stop their aspirin. So in the past, we used to think that people had to stop their aspirin before their colonoscopy. But we know from large studies that polyps can be removed safely when people are on their aspirin. But when it comes to other medications that need to be altered, as I said, if you have diabetes, if you're on blood thinners, those will take a special circumstance and may need to be altered. And your gastroenterologist will let you know when they can be restarted. But some practices don't tell patients when to stop them, because the cardiologist or the vascular person knows best what needs to be done for your specific circumstance.
Yeah. So patients, please be honest with what you're taking. Let your doctors and healthcare providers know. Make sure, if you have multiple different types of providers, a gastroenterologist, cardiologist, primary care, that you're all in sync so that you're getting the best option for yourself and you know what to do without making any missteps. So that's a great point, Dr. Burke, and that's so important. Now, before we wrap this up, are there any other tips? I love the little tips for liquids and things you could drink. Some patients may think, oh my God, I'm going to starve, for 2 days, but that's not really the case. It's actually not the case. So what can we eat during the prep time? Like, what are some of the tips you have for patients?
I'm so glad you asked that because that's one of the points I wanted to get to. In the past, and still currently, sometimes we do colonoscopies for people that have gastrointestinal bleeding. This is mostly in the hospital, right?
Wow.
But most doctors' offices say no red liquids.
Oh.
Well, some people only like red Gatorade, or they like red liquid. So for my patients, where it's just a screening colonoscopy, and I know I'm not looking for a source of blood because you can see color of, the bile can, if you drink blue Gatorade and there's yellow bile, it turns green, right? So I'm like, oh, you had blue Gatorade. So you can drink any clear liquid. So if you can put your newspaper or magazine on the other side of your liquid and see the newsprint, you're good to go. So traditionally, it's a clear liquid diet the full day before the exam. And in most endoscopy centers, you can continue liquids up till 2 hours before your colonoscopy examination. The bowel preparation, you should be completing the last dose no more than 3 to 5 hours before the examination, because you need to give yourself a little time for that to actually evacuate your colon, so you're not finding the local gas station on the highway on the way to the endoscopy center, right? And most people don't have that. We've done studies that have looked at this, split dose prep. It is the standard, right? Split dose. And only 5% of the people actually had, whether they took it all the night before or took it night before and day of, had to stop in a restroom. But the nuance is that there are strong data that suggests that you could eat a low residue diet the day before the exam and still have a successful bowel cleansing. Patient tolerance is better. They prefer it. And there was no decrease in adenoma detection. The worry is you tell a French person you can have a light breakfast and they have a croissant and they have tea. You tell some Americans you can have a light breakfast, and for them, that's 3 pieces of bacon and 4 pieces of toast and 5 waffles. And so you really need a patient that's committed and diligent, but think about white. So I just looked at, some studies that suggest that this low residue diet, which is a plain white potato that's skinned, it is low fat yogurt, it is plain white rice, it is plain white pasta. So there are emerging data that suggest a very bland, small amount of white food with no residue the day before may become standard of care. So just don't do it on your own. Talk to your doctor's office about that. The other thing is nuance. Ask your physician, and I work at a large academic healthcare center. We send a little video link to patients so they know the process of colonoscopy and prep. But other studies show that, enhanced instructions improve patient satisfaction and quality of bowel prep. So, if you have a smartphone, can they send you little reminders, right? So there are text reminders, there's videos, there's podcasts you can watch. So there's other instructions that can help reassure you of what you're doing. So ask your physician's practice, do you have any enhanced instructions, things that you can review, and especially ahead of time? It's almost too late if you're doing it at midnight, the night before your colonoscopy. So try to get some of these adjuncts that your physician's office oftentimes have and can provide to you by a smartphone or your tablet, so you're well prepared.
This is so great. It's almost like I want to do the bowel prep now. I feel like all pumped up
Let's do it.
Ready to do it. It stops, and then it's with the colonoscopy, it's like the best sleep ever. So, I'm always down for that. But seriously, this is a really important topic. It's a really important screening. It's not as bad as people think it is. It's really not. And if it could save your life, there can't be anything better than that. So Dr. Burke, you're amazing. We could talk all day about this, and I'm sure we'll have you on again. Thank you so much for your time. This is awesome. And I really hope this message reaches patients and your families to know that it's going to be okay. The colon prep is not bad. There's options out there. Remember to talk to your doctor, consult with your nurse practitioners. They have great tips and tricks for you to get through this, and you're not alone. So thank you very much and have a great day.
Thank you so much. It was really fun and a pleasure.
It's awesome.
Get screened.
Get screened.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.